Hey, today I'm going to tell you about erectile dysfunction. Erectile dysfunction occurs when a male can't get, keep, or maintain an erection. Most men experience this at some point in their life. It only becomes a problem when the man or the partner considers it a problem. A normal erection is when blood fills two chambers in the private area and the erection happens. This makes the private area extend and stiff, much like a balloon. As it is loaded up with water, the procedure is activated by nerve driving forces from the brain and the genital area. Anything that interferes with these driving forces or confines bloodstream to the private area can bring about erectile dysfunction. Having an erection trouble from time to time isn't necessarily a cause for concern. If erectile dysfunction is an ongoing issue, however, it can cause stress. It can decrease your self-esteem. It can cause self-confidence issues. It can contribute to relationship problems. Problems getting or keeping an erection can also be a sign of an underlying health condition that needs treatment. A big risk factor is heart disease. Male sexual arousal is a complex process that involves the brain, hormones, emotions, nerves, muscles, and blood vessels. Erectile dysfunction can result from a problem with any of these. Likewise, stress and mental health concerns can cause or worsen erectile dysfunction. Sometimes a combination of physical and psychological issues can cause erectile dysfunction. For instance, a minor physical condition can cause this. Sexual response might cause anxiety about maintaining an erection. The resulting anxiety can lead or worsen the erectile dysfunction. In many cases, erectile dysfunction is caused by something physical. Common causes include heart disease, high cholesterol, diabetes, obesity, certain medications including antidepressants, antihistamines, and medications to treat high blood pressure, pain, and prostate problems. Metabolic syndrome, which is a condition involving increased blood pressure, high insulin levels, body fat around the waist, and high cholesterol again. Parkinson's disease, multiple sclerosis, tobacco, alcohol, and substance abuse. The brain plays a key role in triggering the series of physical events that cause an erection, starting with feelings of sexual excitement. A number of things can interfere with sexual feelings and cause or worsen erectile dysfunction. This can include depression, stress, relationship problems due to stress, poor communication, or other concerns. Some clinical manifestations of erectile dysfunction is simply trouble getting an erection, trouble keeping an erection, and reduced sexual desire. For many people, a physical exam and answering questions as far as a medical history is all that's needed for the doctor to diagnose this disorder. If you have a chronic health condition, your doctor suspects that an underlying condition might be involved. You might need further tests. Some of the tests that they can do to diagnose this is a physical exam, which would include a careful examination of your penis and testicles and checking your nerves for sensation. Blood tests, which would check you for heart disease, diabetes, low testosterone levels, and other health conditions. Urine tests, like blood tests, urine tests are used for signs of diabetes and underlying health conditions. An ultrasound can be used to look at the blood vessels that supply the penis to see if there's any blood flow issues in getting to the penis. A psychological exam just to screen for depression. Laboratory workup on a patient with erectile dysfunction should include testosterone levels. Mainly in the morning, patients have low testosterone levels may benefit substantially from replacement. Men may expect significant improvements in libido, self-esteem, and overall energy levels if you just simply replace the testosterone. Some complications of this disease is the person might have an unsatisfactory sex life. Stress or anxiety is a big risk factor, and I've got that listed here. Stress or anxiety, hypertension, heart disease, diabetes, men over the age of 40, It is common. If someone has relationship problems, they may start to develop this condition. It may be some inability to get your partner pregnant. Some medications that they would use to treat this disorder. The first one that was made for erectile dysfunction is Viagra. The other name is Sildenafil. This medication is used also along with Tadalafil, Vardenafil, and Avenafil. So all the ones that end in fil. These 4 medications, what they do is they enhance the effect of nitric oxide, which is a natural chemical in your body that produces and relaxes the muscles in the penis. This increases blood flow and allows you to get an erection in response to sexual stimulation. Taking one of these tablets will not automatically produce an erection. Sexual stimulation is needed first to cause the release of nitric oxide from your penile nerves. Some common side effects of these medicines, just some things to watch out for would be flushing, any redness or anything that you would get in the face. Watch out for nasal congestion. You might develop a headache. It might cause some visual changes, might cause a backache, and also stomach upset. Your doctor will consider your particular situation to determine what kind of medication would work best for your condition. Before taking any medication, you want to tell the doctor exactly what you're already on, exactly what your medical history is. If you're already taking any nitrate drugs, you would not want to take any of these erectile dysfunction drugs, because nitrate drugs is the kind that's commonly used for chest pain, angina, such as nitroglycerin, ascorbate monotrate, other name Monocat, and also if you have heart disease, heart failure, or hypotension, you would not want to, they might not let you take these types of drugs. There was a study I found that it was an extract called Ginkgo biloba. It's a tablet, and after 6 months, it said 50% of the patients reported an improvement in erectile dysfunction just by simply taking this extract. Some other vitamins that are good for this condition is zinc. Zinc may help testosterone levels to increase in men if you're having trouble with the testosterone. It may also help with cholesterol, which would help with the erectile dysfunction. Also, vitamin D is something you can take for this. Some common treatments would be a penis pump, which is simply a pump to pump up your penis to keep it to erect for the sexual intercourse. Also, a penile implant is an inflatable rod, inflatable devices. It allows you to control how long you have an erection. A penile pump. There's things that you can do to help this condition. Moderate exercise is a big thing. You can try some alternative medicine. Something like with a psychological counseling, you might just do something just to try to decrease your stress, just to try to help you calm down a little bit, not get so excited. Would help you. I told you about the extract. Many couples are unaware of the causes that decrease libido and erectile dysfunction. They're often reluctant to discuss it, but it's important to talk with your doctor and discuss everything that might be going on, even in the bedroom, because like I said at the beginning, it could be indicative of heart disease or diabetes or some kind of underlying health condition that you do need to get treated and seen about right away. Some things that you can do to naturally help erectile dysfunction, I put right here. It's exercise, a healthy diet. You want to get enough sleep. You could reduce your alcohol consumption. There's even been studies about body acupuncture that could help, is just helping you de-stress, and also just quit smoking. And that wraps it up. Thank you.